हेलो। आज हम लोग एनाटॉमी पढ़ेंगे। उसमें टॉपिक है बॉडी स्केलेटन एंड स्कल। इसमें एवरी बोन के बारे में हम लोग डिटेल से जानने का प्रयास करेंगे। तो चलिए शुरू करते हैं। बॉडी स्केलेटन, ह्यूमन बॉडी स्केलेटन, फुल एक्सप्लेनेशन फॉर DMLT नीड पैरामेडिकल। द ह्यूमन स्केलेटन इज द internal framework that support the body. It is made up of bones, cartilage, and ligaments. There are 206 bones in the adult human body, organized into two main parts. Axial skeleton 80 bones form the central axis of the body, includes a skull 28 bones, cranial bones 8, frontal, parietal 2, temporal 2, occipital, sphenoid or ethmoid, facial bone 14, nasal 2, maxilla 2, zygomatic 2, mandible. Ear ossicle 6, malleus 2, incus 2, stapes 2. Hyoid bone support the tongue, vertebral column 26, cervical 7, thorax spiral lumbar 5, sacrum 1, coccyx 1, rib cage 25 bones, ribs 24, 12 pair, true ribs 1 to 7, false ribs 8 to 10, or floating ribs 11 to sternum. Manubrium body xiphoid process. Appendicular skeleton 126 bone responsible for movement and limb support includes upper limb, pectoral girdle, shoulder, clavicle 2, scapula 2, arm, forearm, humerus 2, radius 2, ulna 2, hands, carpals, wrist bone 8 into 2 to 16, metacarpals, palm 5 into 2 to 10 हो गया, phalanges fingers 14 into 2 28, lower limb, pelvic girdle, hip bone, ilium, ischium pubis, ilium, ischium pubis, thigh and leg, femur, femur 2, patella 2, tibia 2, fibula 2, knee, feet, tarsal, ankle bone 2, 7 into 2, 14 metatarsals, 5 into 2, 10 phalanges, 14 into 2. Function of the skeleton: support framework of the body, protection, protects organs, example skin, protect brain, movement, muscle attached to bone, mineral storage, especially calcium and phosphorus, blood cell production in red blood, red bone marrow, hematopoiesis. A study tip for DMLT and need focus on bone type: long, short, flat, irregular. Learn anatomy diagram, labeled skeleton, revise bone marking processes, foramina, etc. Okay, skull. Here is a complete explanation of the skull for the multi-need and paramedics. Medical studies with classification, bone names, and function. The human skull. The skull is a bony structure in the head that protect brain, support the face, and form the structure of head. It consists of 22 bones, includes ear, ossicle, and hyoid. A skull is divided into two parts. Cranial bone 8 form the brain cage. Facial bone 14 form the face. Cranial bones, these are enclose and protect the brain. These bones enclose and protect the brain. Bone names: frontal 1, forehead; parietal 2, top skull of head, top and sides of skull; temporal 2, sides of skull near ear; occipital and base of skull; sphenoid 1, base of skull behind eyes; ethmoid, roof of nose between eyes; facial bone 14. These bones form the structure of the face, nose, cheeks, and jaw. Bone name: nasal 2, bridge of the nose; maxilla, upper jaw 2, upper jaw and part of orbit; zygomatic, cheekbone 2, mandible 1, lower jaw only movable bone, lacrimal inner eye corner, palatine though back of hard palate, inferior nasal conchae to inside nose bomber part of nasal septum. Bonus ear ossicle ear middle ear bones 6 total. Though not part of a skull proper, they are associated medius to hammer, incus to anvil, stapes to stirrup, smallest bone in the body. Important features of a skull: foramen magnum, large hole in occipital bone, 4 spinal cord orbit, eyes, sockets, sinuses, air-filled cavity to reduce weight of a skull. Sutures, immovable joints between skull bones. Example: coronal, sagittal, lambdoid, squamous. Functions of a skull. First, protects the brain, supports sensory structure, eyes, ear, nose, provides attachment for muscles, facial expression, chewing, forms entrance to digestive and respiratory tract. Mnemonics to remember cranial bones. Paste of six. Paste of six. Parietal, ethmoid, sphenoid, temporal, occipital, frontal. Paste of parietal, ethmoid, sphenoid, temporal, frontal. Next is sternum. Here is complete explanation of sternum. Sternum breastbone. The sternum is a flat, elongated bone located in anterior front part of the chest. It connects the rib cage and protects the heart, lungs, and major blood vessels. Parts of sternum. The sternum has three main parts: manubrium, upper portion of sternum, articulates with clavicle, collarbone, first pair of ribs, has a depression called the jugular notch at the top center. Body gladiolus, middle and largest part, articulates with rib 2 to 7. Has costal notches for rib attachment, forms most of the anterior rib cage. Xiphoid process, a smallest and lower portion, cartilaginous in young age, ossifies, turns into bone in adulthood. Important anatomical landmark for CPR, cardiopulmonary resuscitations. Cardiopulmonary resuscitation. Avoid pressing hard when there during PCR to prevent injury. Development and ossification develops from 3 ossification centers. Development and ossification develops from three ossification centers. Okay, development and ossification develops from three ossification centers, fully ossified by the age of 40. Xiphoid process ossifies last. Function of sternum: protects heart and lungs. Protects heart and lungs. Attachment site for ribs and clavicle. Supports thoracic case. Assist in breathing mechanism. Clinical relevance: sternum puncture. Bone marrow biopsy is done from the manubrium. Fracture of sternum can occur in car accident. Landmark for CPR: hand position during chest compression is over the lower half of the body of sternum. Manubrium upper, body gladiolus middle, xiphoid process lower. Manubrium articulate with clavicle first rib, body longest part connect second seventh ribs. Xiphoid process lower, cartilage in young youth ossifies with age. Now clavicle, collar bone, clavicle, collarbone. The clavicle is a long S-shaped bone located at the base of neck. S-shaped located at base of neck. It acts as a strut support bar between the sternum, breastbone, and the scapula. Shoulder blade. Basic features. Feature: bone type, long bone, location between sternum and scapula, number in body, though one on each side, shape slightly S-shaped. Function: connects arm to trunk, protects nerves and vessels. Connects arm to trunk, protects nerves and vessels. Ends of clavicle: medial end thick and rounded, articulates with the manubrium of sternum at the sternoclavicular joint. Second lateral acromial end flat and broad, articulates with acromion of scapula at the acromioclavicular joint. Surface and curves: superior surface smooth, can be palpated, felt under the skin. Inferior surface rough with ligaments attached, conoid, tubercle. Medial part convex forward, lateral part concave forward. Function of clavicle: supports the shoulder joint, act as a strut to hold the scapula in position, transmit mechanical force from upper limb to exoskeleton, protects neurovascular structure, example brachial plexus, subclavian vessels. Clinical importance: fracture of clavicle is very common, especially in falls. Fracture usually occurs at the junction of medial two-third and lateral one-third. Important landmark for central line insertion and CPR. Important landmark for central line insertion and CPR. Quick recap table: feature: type long bone, S-shape, articulation sternum, medial, scapula, lateral, function, support, protection, movement, common injuries, clavicle fracture, scapula, scapula, shoulder blade. The scapula is a flat triangular bone located on the posterior side of the thorax, upper back. It plays a key role in shoulder movement and forms part of the shoulder joints. Basic facts: features: bone type flat bone. Description: shape triangular. Number in body 2, 1 on each side. Location: posterior thoracic wall. Ribs 2 to 7. Function: support arms, shoulder joint, muscle attachment. Anatomy of the scapula. Scapula has three borders, three angles, and three surfaces. Border of scapula: superior, upper edge shortest, medial, vertebral closest to vertebral column, lateral, axillary closest to armpit. Angle of scapula: superior angle at the junction of superior and medial border. Inferior angle, lowest angle, easily felt below shoulder. Lateral angle contains glenoid cavity for arm bone attachment. Surfaces of scapula: surface costal, anterior, faces the ribs, has subscapular fossa. Dorsal posterior, seen from behind, has two fossa: supraspinous fossa above spine, infraspinous fossa below spine. Key bony landmark: spines of scapula, a ridge on the posterior surface, a ridge. Key bony landmark: a spine of scapula, a ridge on the posterior surface divides the dorsal surface into supraspinous and infraspinous fossa. Acromion process: lateral extension of a spine, articulates with clavicle at the acromioclavicular joint. Coracoid process: hook-like projection, attachment site for muscles and ligament. Glenoid cavity fossa, shallow socket, articulates with the head of humerus to form the shoulder joint. Functions of a scapula: connects upper limb to trunk, provides attachment for muscles like deltoid, rotator cuff, help in arm movements, flexion, abduction, rotation. Forms shoulder joints: glenohumeral joint. Function of a scapula: first, connect upper limb to trunk, provide attachment for muscle like deltoid, rotator cuff, help in arm movement, flexion, flexion, abduction, rotation. Forms shoulder joint: glenohumeral joint. Clinical importance: fracture is rare due to protection by muscles. Fracture is rare due to protection by muscle. Weak scapula, weak scapular muscles, winged scapula, protrusion of medial border, common site for muscle attachment injuries. Quick revision table: type of bone, flat, triangular, location posterior thorax, back, key processes spine, acromion, coracoid, joint found shoulder joint with humerus, flat triangular, location posterior thorax, back, key process spine, acromion, coracoid, joint formed shoulder joint with humerus, arm bone. The humerus is the long bone of the upper arm extending from shoulder to elbow. It connects the scapula, shoulder blade to the radius and ulna forearm bone. Basic information: features: bone type long bone, location upper arm between shoulder and long bone, location upper arm between shoulder and elbow. Number in body 2, 1 on each side. Articulation: scapula, shoulder, radius and ulna below. Parts of humerus: radius and ulna below elbow. Parts of humerus: the humerus is divided into upper proximal end, soft body, lower distal end. Proximal end, upper end. Structure, function, features: head, rounded, fits into the glenoid cavity of the scapula to form the shoulder joint. Anatomical neck, narrow groove just below the head, just below the head. Greater tubercle, lateral projection for muscle attachment. Greater tubercle. Lesser tubercle in front of greater tubercle for muscle attachment. In front of greater tubercle for muscle attachment. Lesser tubercle. Intertubercular sulcus. Intertubercular sulcus. Grooves between tubercles for tendons of biceps brachii. Biceps brachii. Surgical neck, common site for fractures. Common site for fracture. Surgical neck. Shaft body. Deltoid tuberosity. Rough area on lateral side. Attachment of deltoid muscle. Radial spiral groove. Posterior side for radial nerve and deep artery of arm. Radial or spiral groove. Posterior side for radial nerve and deep artery of arm. Distal end. Lower end. Structure. Capitulum. Description. Lateral rounded before lateral rounded surface articulation with radius. Trochlea. Medial pulley-like surface articulates with ulna. Coronoid fossa. Anterior depression for ulna during elbow flexion. Coronoid fossa. Anterior depression for ulna during elbow flexion. Olecranon fossa. Posterior depression for olecranon of ulna. Olecranon of ulna. Medial and lateral epicondyle. Muscle attachment site. Medial one is more prominent. Function of humerus. Forms the arm's skeletal structure, connects shoulder and elbow joint, provides surface for muscle attachment. Example: deltoid biceps, triceps. Involved in movement of upper limb. Clinical importance: fractures can occur at surgical neck, common in elderly. Mid shaft may injure radial nerve. Surgical neck, common in elderly. Mid shaft head may injure radial nerve. Surgical neck, common in elderly. Mid shaft may injure radial nerve. Supracondylar region, common in children. Radial nerve injury. Wrist drop. Wrist drop, used as site for intramedullary pinning in orthopedics. Radial nerve injury, wrist drop, used as site for intramedullary pinning in orthopedics. तेल लगवा लगी रहती है। Radial nerve injury with wrist drop used as a site for intramedullary pinning in orthopedics. Quick recap table part upper end head head tubercles neck soft deltoid tuberosity radial group lower end capitulum trochlea epicondyle joints formed shoulder with scapula elbow with radius and ulna. Here is a complete explanation of the radius bone, useful for DMLT, NEET and paramedical student. Radius, forearm bone. The radius is one of the two bones in the forearm, the other being the ulna. It is located on the lateral thumb side of the forearm and play a key role in forearm rotation, wrist joint, and hand movement. Basic information. Features: bone type long bone located lateral side of the forearm, thumb side, number in body 2, 1 in each side, articulation humerus, ulna, carpals, wrist bones. Parts of the radius. The radius has upper proximal end to shaft body, upper proximal end to shaft body, third lower distal end. Upper proximal end to shaft body and third lower distal end. Proximal end, upper end. A structure, head, rounded structure that articulates with the capitulum of humerus. Neck, narrow area just below the head. Radial tuberosity, rough bump below neck. Attachment for biceps brachii muscle. Shaft of radius, long curved part of bone, has interosseous border on medial side where it connects with the ulna via interosseous membrane. Cross section triangular. Cross section triangular. Okay. Distal in, lower in, a structure, a stelloid process, description, lateral projection, a stelloid process, lateral projection at the wrist, felt near thumb, a stelloid process, uh, lateral projection at the wrist, felt near thumb, ulnar notch, depression at the medial side, articulates with ulna, articular surface, flat area at the end forms part of the wrist joint. Function of radius: form parts of the elbow and wrist joint, allow rotation of forearm, supination and pronation, works with ulna for flexion, extension of forearm, support hand and transmits forceps from hand to arm. Movements involving radius: supination, palm up; pronation, palm down. The radius crosses over the ulna during pronation. हाँ पाली है तो function of radius: forms part of elbow and wrist joint, allow rotation of forearm, supination and pronation, work with ulna for flexion, extension of forearm, support hand and transmits force from hand to arm. Movements involving radius: supination, palm up; pronation, palm down. The radius crosses over the ulna during pronation. Clinical importance: condition: Colles fracture. Description: common fracture of distal radius, fall on outstretched hand. Colles fracture: common fracture of distal radius, fall on outstretched hand. Radial hand fracture, often due to trauma, affect elbow movement. Styloid process injury can affect wrist joint function. Quick revision table: proximal end, head, neck, radial tuberosity, shaft, long, triangular, interosseous border, shaft, long, triangular, interosseous border, distal end, styloid process, ulnar notch, wrist surface, side of forearm, lateral, thumb side, ulna, forearm bone. The ulna is one of the two bone of the forearm. The other is radius. Hmm? बिजली भी कड़को, धूप भी हुआ, अंधार भी करो, की चल रहा? Ulna is one of the two bone of forearm. The other is the radius. It lies on the medial side, little finger side of the forearm and is the longer than the radius. It mainly contribute to the elbow joint and stabilizes the forearm. Basic facts: features: long bone type, long bone, location medial side of the forearm, little finger side, number in body 2 on each side, articulation humerus, radius, wrist bone indirectly. Parts of Allah. The Allah has three parts: proximal, upper end, shaft, body, and distal end, lower end. Proximal, upper end. Olecranon process, coronoid process, trochlear notch, radial notch. Olecranon process, large curved projection at back of elbow, fits in humerus olecranon fossa. Coronoid process, front projection that fits into coronoid fossa during elbow flexion. Trochlear notch, C-shaped notch between olecranon and coronoid, articulates with trochlea of humerus. Radial notch on lateral side, articulates with head of radius. Lateral side articulates with head of radius. Radial notch on lateral side articulates with head of radius. Shaft of Allah, long and triangular, has a interosseous border on lateral side, connects with radius via interosseous membrane, provides a surface for muscle attachment. मोबाइल में फोकस करते करते बताओ कितना एनर्जी लगे distal end, lower end, a structure head of Allah. Description: a small round area at lower end, articulates with radius. Styloid process, pointed projection felt at wrist near the finger. Styloid process. No direct wrist articulation. Unlike radius, ulna does not directly form the wrist joint. Function of ulna: forms the major part of the elbow joint with the humerus, act as a stabilizing bone in the forearm, works with radius for movements like flexion, extension at elbow, pronation, supination of forearm, supports muscle attachment for hand and forearm movements and roll with radius. During supination pronation, the radius rotates over the ulna. Ulna remains mostly fixed during this movement. The radius rotates over the ulna. Ulna remains mostly fixed during these movements. Movement and roll with radius. During supination pronation, the radius rotates over the ulna. Ulna remains mostly fixed during this movement. Clinical importance condition olecranon fracture, common in falls or direct elbow trauma, night stick fracture, isolated fracture of the shaft of ulna, often in defense injury.